my name is L1T203 and I am from Group 3. I'm gonna present to you research disease related to heart attack. For introduction, anatomy is the study of the structure and organization of living organism, focusing on the physical component and system that make up the human body. A heart attack is a medical emergency when the blood supply to a part of the heart is blocked, usually by a blood clot. This can cause damage. To the heart muscle and be life-threatening. Heart attack symptoms can vary from mild to severe. Chest pain and dizziness are the main signs, but other symptoms such as fatigue, nausea, and shortness of breath are possible. Vomiting is more prevalent in women.
My name is Nordiana Shira binti Kamal Zaman. My treat number HWT10203. Now I want to present about normal function. The heart is an important organ in the human body. It is located between the lung and the center of the chest. The function of the heart is to pump blood throughout the body. The heart supplies and distributes oxygen throughout the body and remove carbon dioxide from the body. In addition, the heart also works to pump blood. It is able to produce 40,000 liters of blood in a day. The heart is a cavity that is moved by a muscle called the cardiac muscle and function to pump blood throughout the blood vessel. Last function of the heart is the human body is to transport waste product. The intended waste material can be carbon dioxide as a result of cellular respiration, where carbon dioxide is transported from the rest of the body along which the heart beats and removed through the respiration tract.
Hi, Assalamualaikum. My name is Nur Atika binti Hairudin. My matric number is H22A0176.
Right now, I want to present about my part in assignment group about mechanism of disease development. Firstly, I want to talk about disease mechanism occur because the attack on the place evolved in development of disease. Disease can happen such as heart disease is common thing that happen to all people. Accumulation blocker in the blood flow to be heart attack in the body. It can give impact at heart. Next is myocardial infarction occur when the heart muscle does not to get enough blood and is caused by decrease. Most occur due to blocker enteritis, the leading cause of death. Heart disease can cause person become uncomfortable in the body, such as tightness in the chest, pain in the neck, jaw, and shoulder. It has sign and system in the body. Is also strong pressure caused by a temporary decrease in the blood flow to the heart.
Structure part of body system. How disease happen? Mechanism of disease development. The heart, there are two parts which have an upper and lower chamber, the atrium and the ventricle. The atrium is the part that receives blood from the lungs and sends it to the left ventricle, and the risk of a heart attack is the amount of blood supply restriction that is too thick, the amount of muscle that is affected, and the area of the body that is the heart is affect a lot. Heart failure can cause a person short of breath and worsen monitoring in daily life. Heart disease is one of the most dangerous chronic disease, which is a heart attack caused by a failure to supply enough blood to other parts of the bloodstream to achieve good normal function. The cause of heart disease are also part of human daily activities in life, such as smoking, unhealthy diet, high cholesterol, high blood pressure, and many more, which are the cause of heart attack. A heart attack will change a person's life because it will be normal to feel pressure in certain part. And this heart attack disease also happens to young people, including the elderly who are easily affected by disease.
I want to tell mechanism of blood circulation throughout the head. 1. The vena cava transport oxygenated blood from the body's rest to the right atrium. 2. When the right atrium wall is filled with blood, it contracts and pushes the blood through the tricuspid vein into the right ventricle. 3. When the right ventricle filled with blood, the wall sucks it up and pushes it through the sickle vein to the pulmonary artery and then directly to the lung. 4. Gas exchange occurs in the lung. Carbon dioxide will be expelled while oxygen will be taken into the bloodstream. 5. Through the pulmonary veins, oxygenated blood will travel from the lung into the left atrium. Next, the left atrial wall contracts, forcing blood through the bicuspid valve into the left ventricle.
There is two mechanisms of blood, which is oxygenated blood and the second is deoxygenated blood. So the difference between it, firstly, oxygen concentration. The oxygenated blood have a lot of oxygen. Then the deoxygenated blood have a low, insufficient oxygen. Secondly, color. The color of oxygenated blood is bright red. Then the deoxygenated blood is dark red. And the last is blood vessels involved. The oxygenated blood have all arteries except pulmonary artery. Then the deoxygenated blood have all veins except pulmonary.
My name is Nur Shazwani binti Rosti, metric number H22A0876. When disease happen, system and causes. The most likely to have a heart attack is a man aged 45 and older and woman aged 55 and older than a younger man and woman. Besides, people in 20 and 30 years old having a heart attack where they face the same risk as older patients. Other than that, heart attack also could happen to pregnant women. More than 75% of pregnancy-associated heart attack are women 30 years old and older. When pregnant, blood volume can increase 45%, stressing the heart's workload as it pumps extra blood to sustain the baby's growth, so it can contribute to more serious complications. Next, the causes of heart attack is COVID-19 and other virus infections, which may damage the heart muscle. Other than that, people who had diabetes may raise heart attack. Lastly, smoking that change the blood chemistry which can gun up the arteries. The effect is make more difficult for blood to flow and increase the risk of heart blockage.
Assalamualaikum and good morning. My name is Muhammad Dambi Hasan Anwar. My metric number H22A0620. So today I'm gonna talk about measure to prevent disease or disease management. Number 1, know your risk. If you are between 40 and 70 years old and have never had a heart attack or stroke, use our change control calculator to estimate your risk of having a cardiovascular event in the next 10 years. Certain factors can increase your risk, such as smoking, kidney disease, or a family history of early heart disease. Knowing your risk factor can help you and your healthcare team decide on the best treatment plan for you. Many risk factors can be improved with lifestyle change. Number 2, take a medicine. If you have a healthy condition, your doctor may prescribe statin or other medication to help control cholesterol, blood sugar and blood pressure. Take all medication as directed, but don't take aspirin as a preventive measure unless your doctor tell you to. If you if you have never had a heart attack or stroke, a daily aspirin may not help you at all and could cause problems including risk of bleeding. If you had a heart attack or stroke, your doctor may want you to take a low dose of aspirin to reduce your risk of having others. Okay, next, number 3, maintain weight. Make sure your weight does not reach level of obesity by exercising regularly. Regular daily physical activity can reduce the risk of heart disease and can help control your weight. By doing regular exercise, it also reduces the chance of getting other diseases that can put stress on the heart, such as high blood pressure, high cholesterol, and type 2 diabetes. It is recommended to do moderate intensity exercise such as cycling, walking, gardening, cleaning the house, climbing stairs, and walk the dog every week. There is no need to do heavy exercise to prevent heart attack. Number 4, eating a balanced and healthy diet. Do not eat food that contain excess fat. Increase the intake of vegetables, fruit, legumes, meat, lean fish, low fat or fat-free dairy food, whole grain and healthy fat such as olive oil in your daily diet in balanced quantities. Avoid eating food that have artificial flavoring and coloring. Make smart choice like limiting refined carbohydrate, processed meat and sweetness drink. Use the nutrition fact label on packaging food to cut back on sodium, added sugar and saturated fat and avoid trans fat. Okay, lastly, live tobacco free. Smoking or vape is the main factor in the formation of atherosclerosis. Chemical in tobacco can damage the heart and blood vessels. Cigarette smoke reduce oxygen in the blood, which increase blood pressure and heart rate because the heart has to work harder to supply enough oxygen to the body and brain. This means that even if you are not smoker, make sure avoid second-hand smoke. The risk of heart disease begin to increase as earlier as a day after quitting. After a year without smoking, the risk of heart disease dropped to about half that of a smoker. That's all from me. Thank you.
To conclusion, the heart is an important organ in the woman's body to continue alive. People should take care of their health in order to avoid various diseases that can cause health problems. A heart attack can cause death. One of the ways to prevent heart diseases is to eat a healthy diet. How to practice healthy eating and know the natural. This way can help us to improve our heart healthy.